All right, so this is the update on Kiara's blood tests and her uh, ultrasound update that she had done last week. And if you look over here on the right, this is the test that was performed on November 19th, just last week, and these are the results on the left from October 8th. So things are looking much better. This is a huge improvement. As you can see, all these levels over here that are in the red and blue are high and low. And over here, you can see all of her levels are almost 100% normal except for two, which are so close to the normal range. It's almost, it means absolutely nothing. It's almost nothing to worry about. So the only things that came back from her recent results that showed that it was low or high was an increased SDMA, which was at 20.2, and in the normal range in cats, it's 20.0. So it's zero point 0.2 higher, which is tiny. That's awesome. That's what we want to see. It is so close to the normal range, it's almost considered normal. And then the other one, which is down here, is the absolute lymphocytes, which was low. The normal range is 1,200 to 8,000, and she had 1,196, which is just 4 under the normal range, which is awesome. They're basically normal. Across the board, she's basically coming in at normal levels. You can see over here for her previous results, October 8th, her glucose was at 175, which was high. Her glucose now is at 97, which is in the normal range. Her phosphorus was 2.2, which over here is 4.1, back in the normal range. Her calcium was 8.2, which is now at 9.6, back in the normal range. Total protein was 4.9. Over here, her total protein is 7.2, back in that normal range. Albumin, 2.4, and over here is at 3.5. Globulins at 2.5, and over here it's at 3.7. Her ALT, which was really high, 540. The normal range is the normal high is 143. She was at 540, and now she is at 67, which is right in that normal range. These are amazing results. Even her alk phos, which is right here, 27. Before, it was at 96, which was really high. The normal high range for that was 65. And then her bilirubin was at 1.5, which was high, and now it's at 0.1, which is back in that normal range. Just barely in that normal range, but it's back in that normal range. Everything is back to normal for her. We can even scroll down here and see her platelet levels. Her platelet count is 265. The normal range is between 200 and 500, which is awesome. Before, her platelets were very low, below average. She's coming in at about 19%, and now she's right in that normal range, which is amazing. So her platelet is back to normal. These are amazing numbers, especially when we want to see her improving. She's improving tremendously. Her numbers are basically 99.9% back to normal. That's exactly what we want to see. And then the other thing was with her ultrasound findings. So in her ultrasound, they found almost, oops, hold on. This one still has the ultrasound stuff on it. This is just the same thing as that. So let's get back to that. And then we need to get back up to this guy. So this was her ultrasound findings before. Besides the large tumors that they removed, they found other masses in her liver that were approximately underneath 1 centimeter large, and that is about the same what they found in her new ultrasound findings, which was about a 7 millimeter diameter hypoecnoic nodule in the midcranial liver. It's about the same size as when they did the previous ultrasound, so it's not growing. Her liver cancer is not growing. The tumors are not getting bigger. They're staying right around the same size. It may have increased very slightly, but not by much, which, as I discussed in the previous video, that we should have seen but we should have seen a very noticeable increase over the time that it took, over the time between her previous ultrasound and her most recent ultrasound. The fact that it hasn't grown means that it hasn't, her time hasn't gone down with her time on this earth. The vet said before on the day of diagnosis back in October 8th, that she had about 3 months to live. And then after this most recent ultrasound, they told us she still has 3 months to live, so we've given her almost a month and a half, 2 months extra time with the ivermectin treatment. That's awesome, but we don't want to stop there, and that's why we are going for the additional treatments such as sorafenib, which is going to be the nail in the coffin for cancer. Like I said in the previous video, there's no studies on how it affects cats, so we're gonna have to take it very slow. I'll explain it more in detail with the next video when ivermectin is taken in combination with sorafenib. But this is looking great. These are awesome results that we were hoping to see. We were actually hoping to see it go, the cancer cells start to dissipate, but looks like ivermectin is not going to be able to do it alone. So we're going to have to incorporate some more things that can help ivermectin finish the job, and that's where we're at right now. The only other things that they found in her ultrasound was her lymph nodes. There's a mildly enlarged and hypoecnoic hepatic node seen. So that's probably her lymph nodes trying to fight off all of the cancer cells that are still in her liver. But the other thing they found was the bubble that's still in her abdomen between her sutures, which is about 4 centimeters in length. It is getting smaller. It's continuing to shrink, which is big. We're no longer putting her on gabapentin, so we're hoping that it goes away on its own at this point without the gabapentin, and it looks like it is. So we have to keep up on that, make sure it's disappearing. But they said it's most likely granuloma, which is what it is. However, neoplasia cannot be ruled out, and it can. So we're hoping to see that bubble go away as time ticks on. But that's amazing. Like, these are incredible results that we're seeing. The fact that it's it's not growing, it's stagnated. That's awesome, and we want to see that start to dissipate instead of just stagnate. So in the next video, we'll go over that, what we're going to do with sorafenib, and see if we can't get this thing completely knocked out. But yes, her results are looking absolutely fantastic, because if we go back down to these numbers here and go back to these numbers over here, the fact that everything is back in normal range is a huge plus. We're looking at a pretty good result so far. So with that being said, things are looking up. We're gonna keep on this train and see if we can make sure that it keeps getting better and better, and hopefully by the next time we do an ultrasound, we can see cancer cells going from 7 millimeters down to 6, then maybe 5, 4, all the way until it's gone. And that's what we're hoping for. That's what we're gonna try to do. All right. Next video is going to be about sorafenib in combination with ivermectin, and how and why we're going to use that to try to get rid of these cancer cells.